After you've been hurt in an accident, you're going to need treatment. And that is the second step of the pre-litigation phase that I was discussing in an earlier video. And that treatment at first is going to be your emergency treatment. That's going to be you going in an ambulance to the hospital if it's necessary, or going to the ER immediately after an accident. But many times, we're not feeling pain immediately after a slip and fall or a trip and fall or an accident. It just doesn't hit till later. And that's okay. That's normal. So when you wake up after 1 day, 2 days, and you start feeling that pain, it's best to go to an urgent care or some sort of doctor to get this checked out and see what's going on. After you go to the ER, they're going to check you out with x-rays, make sure how many fractures to your bone, fill out your soft tissues, and give you a general understanding of the injuries that you sustain. But at the end of the day, they're still going to want you to see your primary care provider. If you have one of those, then great. Schedule an appointment immediately and get in and see that person. They will give you a recommendation and help on what to do next to help recover from this car accident or trip and fall, wherever the incident might be. However, another option that many people consider is doing physical therapy. Now, when you're quoting the law, you want it to be exact. And the Nevada law has given a law of what physical therapy is. And I have it here, and I'm going to read it for you. It's at NRS 640.022, and it says that physical therapy is a specialty in the field of health which is concerned with the prevention of disability and physical rehabilitation of persons having congenital or acquired disabilities. Now, that law right there probably has people saying, well, I'm not disabled. And I'm not saying you are disabled, but you are hurt. And you are at a point that you weren't before this incident. You weren't feeling this pain before this incident, and physical therapy is a great tool to get you back to a point that you were before this incident. Now, people have gone through physical therapy can lessen the time that they need treatment, can prevent future disabilities becoming permanent, and can also just give general relief and comfort to people dealing with these type of soft tissues injuries. It's a great thing that I recommend. Now, of course, I'm not a doctor. I can't prescribe any sort of medical treatment to you, but I've seen a lot of my clients go through physical therapy and it has great results. A common question I get asked, though, with physical therapy and all sorts of treatment is like, well, how long is this going to take? And frankly, once again, I'm not a doctor. I can't tell you how long it's going to take. The answer that your mom would give you is it takes as long as it takes. However, there is some truth to that. Some lesser injuries can only take weeks, but some will go on for months. And then larger things, including up to surgery, can be a year-long process. But I can tell you what, my job is to work very close with your medical providers, know exactly what's going on and how it fits into your case and the overall structure, but get you the maximum recovery, including this treatment and pain and suffering that I can. So, if you're dealing with treatment of any sort, whether it be physical therapy, larger, just seeing your primary care provider, please contact us and discuss it with us. We give free consultations, and I'll be happy to walk you through your treatment and your pre-litigation plan for your personal injury case.